A stroke does not always begin with pain. Sometimes it begins with a face that suddenly looks uneven, a sentence that no longer sounds clear, or an arm that quietly loses strength. And in that moment, the biggest danger is not only the stroke itself, it is delay. Because inside the brain, every minute can change the future. In this video, we'll explore what actually happens inside the brain during a stroke, why doctors say time is brain, and the key factors that influence recovery. Make sure to watch until the end, because one important factor that can significantly affect recovery is often overlooked. Let's first understand what a stroke actually is. A stroke occurs when part of the brain suddenly stops receiving the blood supply it needs. The most common type is an ischemic stroke, which happens when a blood clot blocks an artery that supplies blood to the brain. The second, less common type is a hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures, causing bleeding. In both cases, brain tissue can be damaged, but the causes and treatments are different. That is why doctors first determine which type of stroke has occurred before deciding on the most appropriate treatment. Now the question is, what actually happens inside the brain? Blood does much more than carry oxygen. It also delivers glucose, nutrients, hormones, and other essential substances that brain cells need to stay alive and function properly. When blood flow is interrupted, brain cells are suddenly deprived of oxygen and energy. Within just a few minutes, these cells begin to malfunction, and if blood flow is not restored quickly, many brain cells can die permanently. That is why neurologists around the world say, time is brain. Every minute matters, because prompt treatment can help save brain tissue and significantly improve the chances of recovery. But that's not where the story ends. The symptoms a person experiences depend on which part of the brain has been affected. If the area responsible for movement is damaged, it can cause weakness or paralysis on one side of the body. If the language center is affected, the person may have difficulty speaking or understanding words. Some people may also experience problems with vision, balance, memory, swallowing, or coordination. Every stroke is different because different parts of the brain control different functions. Most importantly, everyone should know how to recognize the warning signs of a stroke. In the UK and many other countries, doctors recommend remembering one simple word: F.A.S.T. F. Face. Has one side of the face drooped? A. Arms. Can the person raise both arms, or does one arm drift downward? S. Speech. Is their speech slurred, or are they having difficulty speaking or understanding what is being said? T. Time. If you notice any of these signs, call emergency medical services immediately. Some people may also experience sudden vision loss, severe dizziness, difficulty walking, confusion, or a sudden, severe headache, especially with certain types of stroke. These symptoms should never be ignored. Many people ask, who is at the highest risk of having a stroke? Several factors can increase the risk of having a stroke. High blood pressure is the single biggest risk factor because it gradually damages the blood vessels over time. Diabetes can also increase stroke risk by affecting blood vessels. Other major risk factors include high cholesterol, smoking, and irregular heart rhythms such as atrial fibrillation, obesity, physical inactivity, excessive alcohol consumption, and advancing age. While age cannot be changed, many of these risk factors can be reduced through healthy lifestyle choices and appropriate medical care. This surprises many people. This is something that surprises many people. A common myth is that every stroke happens without any warning. In reality, some people experience a transient ischemic attack, TIA, often called a mini-stroke. The symptoms are similar to those of a stroke but usually resolve within minutes or a few hours. Even if the symptoms disappear completely, a TIA is still a medical emergency because it can be a warning that a major stroke may occur soon. Prompt medical assessment is essential. When a patient arrives at the hospital, doctors work quickly to determine the type of stroke. A brain CT scan or MRI helps identify whether the stroke is caused by a blocked artery or by bleeding. Blood tests, heart monitoring, and imaging of the blood vessels may also be performed to identify the underlying cause and guide treatment. Treatment depends entirely on the type of stroke. For many patients with an ischemic stroke, clot-dissolving medication may be appropriate if it can be given within the recommended treatment window and the patient's medical condition makes them eligible. Some patients may also benefit from a specialized procedure called a mechanical thrombectomy, in which doctors use tiny instruments passed through the blood vessels to remove the clot. If the stroke is caused by bleeding, treatment focuses on controlling the bleeding, reducing pressure inside the brain, and preventing further complications. Because the treatments are completely different, doctors never assume the type of stroke without first performing brain imaging. Now let's talk about the question that is often the biggest concern for families. How long does recovery take? Recovery varies greatly from person to person. Some people recover quickly, while others require months of rehabilitation, and some continue to improve for years. There is no single timeline that applies to every patient. Several factors influence recovery. The first factor is the severity and location of the stroke. A small stroke affecting a less critical area of the brain may allow for a relatively faster recovery. However, a major stroke, especially one involving areas responsible for essential brain functions, can lead to a longer and more challenging recovery. The second factor is how quickly treatment begins. People who receive emergency treatment promptly often have a better chance of preserving brain tissue and reducing long-term disability. That is why recognizing the symptoms early and seeking emergency medical help immediately is so important. The third factor is rehabilitation. Physiotherapists help patients regain movement, strength, and balance. Occupational therapists teach practical skills needed for everyday life. Speech and language therapists help people who have difficulty speaking, communicating, or swallowing. Rehabilitation usually begins as soon as it is medically safe and continues according to each patient's individual needs. Another factor that should never be underestimated is emotional well-being. After a stroke, feelings of anxiety, depression, frustration, and helplessness are common. Support from family, healthcare professionals, and rehabilitation teams can make a meaningful difference by helping patients stay motivated and actively engaged in their recovery. Finally, let's talk about prevention. Not every stroke can be prevented, but the risk of many strokes can be significantly reduced. Controlling blood pressure, managing diabetes and cholesterol, avoiding smoking, staying physically active, maintaining a healthy weight, eating a balanced diet, limiting alcohol consumption, taking prescribed medications as directed by your doctor, and attending regular medical checkups can all help lower the risk of stroke. If you have atrial fibrillation or another heart condition, following your doctor's treatment plan is especially important. The key message is simple. Stroke is a medical emergency, but rapid recognition, immediate treatment, and ongoing rehabilitation can make a significant difference in recovery. Remember the fast warning signs, don't delay, and make sure your family and friends know them too. One quick decision today could help preserve brain function, reduce disability, and even save a life. Remember, this video is for educational purposes only and is not a substitute for professional medical advice. If you or someone near you develops sudden symptoms of a stroke, seek emergency medical care immediately. Early action gives the brain the best possible chance of recovery.